A new approach to open heart surgery gives patients less scars and recovery time, and it's being performed right here in La Crosse. News Channel 8's Kristen Elisario tells us how a local doctor is one of the first in Wisconsin to use this new technique.
A doctor at Gunderson Lutheran has been performing minimally invasive heart bypass surgery since December. So far, 25 patients have undergone the operation, one of them being a heart attack survivor who says he's glad this option was available because the operation table is the last place he expected to be.
53-year-old Mark Neville was, for the most part, healthy. He visits the doctor regularly, exercises frequently, and eats healthy. On Christmas Eve, he had a heart attack and flatlined in Gunderson Lutheran's emergency room. With 95% blockage in one of his arteries, Neville was one of the first patients to undergo minimal invasive coronary surgery.
I figured if they thought I was a candidate and others did it and survived, I was game.
The new approach to an old procedure accesses the heart through a smaller incision between the ribs and below the left breast. Previously, to access the heart, the breastbone would have to be cracked and ribs pried open.
It's a whole new way of looking at the heart through a small, tiny hole or an opening between the ribs. It's not quite the same visualization as being in the chest through a traditional sternotomy where we open things up.
In heart bypass surgery, surgeons use vessels from other areas of the body.
They took one vein out of the leg and an artery out of the chest and just sewn a bypass over the blockage to the vessels underneath.
The procedure itself is more tedious for surgeons, but the smaller scar has many benefits.
And just cutting between the ribs, soft tissue, not cutting any bone, we're just spreading between the ribs, close them back up. People are doing wonderfully within a couple of weeks.
In traditional open heart surgery, recovery time is about 2 months. With minimal invasive surgery, it's about 2 weeks. What's quickly improving with the surgery is the number of bypasses surgeons are able to do. When it was first introduced, surgeons could do 1 bypass. Now they're able to do 3 or 4.
Thank you very much, Kristen. Not everyone qualifies for the surgery. The size of the patient and where the problem areas within the heart are located both factor into it. But doctors say with more repetition, they are quickly expanding what patients they can take.